Hello and welcome. My name is Nadia Chilias and I am the President and Chair of the Board of the St. Maarten Red Cross. Thank you for taking the time to tune in to our mini-series of our First Aid Save the Life campaign. The fact that you took some time out to watch means that you really care a whole lot about saving someone's life and even your own. For the first time ever on St. Maarten, the St. Maarten Red Cross will be showcasing a live production broadcast about first aid assistance and the importance of why it is an added value skill for your life. Whether it's a hurricane, a car accident, or a home emergency, you may be the one person to save your neighbor, a family member, or even a stranger's life. As a worldwide recognized first responder for first aid, we will be sharing valuable tips with some simple techniques that could be a difference between life and death for someone's existence. This is a limited series for the month of September and October, so do look out for the dates where you can tune in live on YouTube or Facebook, or you can register on the link below to participate in person in one of our live demonstration events. This is where you can also get certified and receive a certificate from the American University of the Caribbean School of Medicine for their Stop the Bleed campaign. See you there.
Hello, my name is Rose Bedrigian. I'm a 5th semester medical student here at AUC. I'm the previous president of the Disaster Medicine Interest Group here on campus. And today we have our wonderful Stop the Bleed coordinators, Edgar and Michelle, to present this training to you. On behalf of AUC administration, faculty, and all of the students, we wanted to say thank you so much for giving us the opportunity to share the island with you for the last 2 years, or the first 2 years of our medical career. St. Maarten has been an amazing experience. We're so grateful to get to enjoy it, and we look forward to getting more integrated into the community. So thank you so much, and hopefully you will be seeing more of us. And thank you to the Red Cross for allowing us to work with you as well. That being said, I will leave it off to Edgar and Michelle.
Good morning. My name is Edgar Chavez. I'm a student here at AUC. I'm also a certified advanced EMT back in the United States. And I'm an instructor for Stop the Bleed underneath Dr. Addison here. So how about we get started with this? This is going to be a great activity for you guys where essentially we're here to teach you how to save a life by simply stopping a bleed. So as you guys can see here, the American College of Surgeons Committee on Trauma, the American College of Emergency Physicians, the National Association of Medical Technicians, and the Committee of Tactical Combat Casualty Care came together to develop a program that could be taught to anybody. Young kids can learn how to do this up to someone that's 70 years old. It's made simple so anybody in the face of an emergency can come together, know what to do, and help save a life. So just a heads up, some images might be slightly disturbing for some viewers. We're not going to show any blood or anything. It's just mannequins that are being used. We just like to give a heads up for you guys. So why are you guys taking this training? What they came up with is the #1 cause of preventable death after injury is bleeding. So if, if someone gets injured, if it's severe enough, that could be the main issue. But the next thing that comes up is bleeding. If you have an injury, there's probably going to be some blood loss due to the injury itself. Where can you guys use this training? Any ideas where this might come into play?
Everywhere.
Yep, perfect. So everywhere. You could use this at your house. You're cooking, you can accidentally cut yourself. This could happen at a school. This could happen if there's a shooting anywhere. This can happen in a natural disaster. Here at St. Martin, we really like to focus on, hurricanes. Since we are here in the Caribbean, a hurricane can come through and there's going to be people that are injured. Some of these injuries might lead to bleeding or blood loss. The next one, car accidents. There's cars everywhere. Everybody uses them. There's going to be car accidents that are going to happen, and that's where you want to be ready for that. In my car back home, I always carry a tourniquet inside of the car, just in case I ever come to a situation where I might need it. And then just like I was mentioned, anywhere. It could be inside the office, it could be at the park, it could be when you're outside at the beach. Emergencies happen anywhere throughout, so you have to be ready for them wherever they happen. So what are the goals for this training? At the end of this, we want you to be able to identify any life-threatening bleeds. There's going to be, when someone's injured, they might be bleeding from their head due to a small cut there, but because it's on the head, there's going to be a lot of bleeding that's going to be associated with that. Is it necessarily life-threatening? Most of the time, probably not, but we want you guys to be able to recognize what's, a small bleed versus a large bleed that could potentially kill someone. The next goal is going to be stop the bleed. And we're going to teach you the 3 steps to stopping the bleed, which is pressure, packing, and then applying a tourniquet. We teach it to you in a way where you slowly build up to a tourniquet. The tourniquet's to be the most evasive part of, or the most evasive procedure you guys can do. So you always want to start with the least invasive and move forward. Usually enough pressure done properly is enough to stop most bleeds. So the first thing is your safety. Your safety is going to be the number one with any training or any training that you guys get. You guys will be told this, that safety, your personal safety is going to be the number one. Because if you get injured, that makes 2 patients. That's not going to help the patient that was already injured in there. So make sure, if there's 1 patient, it only stays 1 patient. You don't want to be the second patient. So always check your surroundings. Only help when you guys see that it's safe to do so. I know instinctively you guys are going to want to jump in there and help someone, but if it's not safe, don't do it. Wait for emergency personnel to arrive, and then they can take over and assess from there. Say you are helping someone. Say they're trapped in their car, and out of nowhere there's smoke and there's a flame that starts up. You guys have to remove yourself from that situation, because if you stay there, then that increases the risk of you guys becoming the second patient. And again, don't become a second patient. In case, that does arise, you're going to stop, remove yourself from that situation. If you guys are able to, and by saying that, able to do it safely, you can remove the patient with you. That's by, dragging them out, but only if you can. But if it becomes too unsafe for you, just leave the patient there, step back, wait for personnel to come and assist. Next, you guys, in an accident, there's going to be blood. So you guys want to be protected. That's where you want to have a pair of gloves. The way I do it is in my tourniquet, it comes in a little plastic wrap. I always have a pair of gloves in there. That way I always have gloves with the tourniquet. That way I don't have to, think of grabbing gloves and grabbing the tourniquet. Everything's right there. Everything's easy for me. That way I don't get exposed to any blood. In the event that you don't have the gloves and you get blood on yourself, make sure you properly clean the area. Wash with soap. Usually the normal rule, everybody knows 20 seconds using the ABCs while you do it. If you have blood on you, you're going to want to increase that. Wash for 2 minutes, 5 minutes, until you feel like you cleaned the area thoroughly. Next, we would suggest that you do visit a doctor and let them know that you were exposed to blood. Tell them what happened, what you did. Then that way, if they feel like, they can continue further care to make sure you guys remain safe after the initial exposure to blood. So now we move on to the actual training of Stop the Bleed. And this is where we follow the ABC rule. The first one is alert emergency services. Here on St. Maarten, you guys are going to call 912. That way it gets you to the dispatcher for the ambulance. They'll be able to walk you through what to do. If you guys forget how to apply the tourniquet, don't worry. They know exactly how to walk you through it. The next is going to be bleed. You guys are going to learn how to identify the bleed. After you have identified it, then you're going to move on to the next person, which is compress. That's where you apply pressure, and if you need to, that's where you apply the tourniquet. So we're going to go through each one and explain to you guys what to do. So again, A stands for alert emergency services, which is 912 here. So you're going to call them. Make sure you know where you are. If you don't, try to give landmarks to where you are, but don't just say, I'm next to the tree. There's a lot of trees here in St. Maarten, okay? But be like, I'm by the airport. I can see, the Red Cross is across from where I am. Or I'm in front of AUC. Give big landmarks so they kind of know a general area of where you might be. But don't, be, next to the beach. Which beach? Give them names, tell them exactly where you are. Also, when you call, remain calm. I know someone in front of you is bleeding, they're screaming, but you have to remain calm. You have to be that calm person in front of everybody. That way you can communicate with the dispatcher more easily. Let them know what happened. If you guys just showed up on a car accident, tell them there was a car accident. Was there one car? Was there two cars? 3 or 4? Let them know that stuff so they can dispatch the proper personnel. Also let them know how many patients you have. Is there 1 patient? Is there 20 patients? All this information is good for them. And then let them know as far as safety concerns. Is the car on fire? Was this a shark attack? Was this someone that just got shot? Let them know what's going on around the big picture. And then just follow their instructions. Is that, whatever they tell you to do, follow what they do. They're trained for this. They'll be able to calmly walk you through any situation. So next, we move on to B, which is bleeding. With bleeding, you guys want to find the source of the bleed. In an emergency, you might see a cut on the head, scraped on the arm. There's going to be multiple things that could be happening. Talk to your patients. Introduce yourselves. Say, hey, my name is Edgar. I'm here to help you. Can you tell me where it hurts? Can you tell me where you've been injured? A patient that's been hurt, they'll tell you where it hurts. You don't have to go digging for anything. They'll tell you, look, if there's going to be blood, you're going to be able to see it. It might be hidden by their clothing. So make sure you ask them, hey, does your stomach hurt? Do you feel wetness anywhere showing that there might be bleeding there? So what are you going to be looking for? The main one is continuous bleeding. You want to make sure that you're not too focused on a little scrape on the arm when, say, they have a major bleed on their leg. So look for blood or an injury that is continuously bleeding. Next, look for large volumes of blood. That may be hidden by clothing, because if you're wearing pants, it might be hard to see that. And large volumes of bleeding also come in with the next point, which is pooling of blood. So is there a puddle of blood? If there's a puddle, you can assume there's large bleeding happening at some part of the body. Look for that. See if it's towards the legs, towards the head. And then that way it kind of guides you where to look for this injury. Know that there may be multiple places where the patient's bleeding. again, you guys are gonna have to be able to determine, hey, should I focus on this bleed up here on the shoulder or the one on the leg? Or it might be both. So just know, just because you see one spot doesn't mean it's just one spot. It could be anywhere, and there could be multiple of them. And then clothing, again, here on the island, a lot of the time people are wearing shorts and a t-shirt, so it's not too hard to not see the bleeding. But say you go on a trip, you go skiing, you're wearing a big jacket, you're wearing snow pants, that's gonna hide a lot of the injuries. So if you have to ask him, hey, are you able to lift your shirt so I can look at your stomach? If they're wearing pants, hey, can you pull up your pants to see, I need to check your leg. Talk with your patient, tell them what you're doing. Next, they kind of separate it into different portions as to where bleeding might happen. You might have the arms and the legs. You might have the neck, the armpit, or the groin area. That's where they like us to focus on some of the major ones. The reason why the neck, armpit, and groin area might harbor some big bleeds is a lot of blood vessels go through those areas because they have to go all the way to your legs, So that's a major source for bleeding. And the neck space is just, like the abdomen and the chest. You have vital organs in there, and it's a big area that could easily get injured. So once you guys identified where the bleed is, you're going to move on to the next step, which is actually stopping the bleed. And this is going to be done through compression or pressure. So first, you want to do the least invasive, which is apply direct pressure to the wound. So if you identified that it's here on the arm, you're going to use a shirt, gauze, whatever you can, to cover the area, but don't apply too much of the clothing to it because it's going to hinder. When you apply pressure, you're going to use a two-hand technique. You're going to push hard, and just know that the patient will be in pain. That a patient that's screaming and in pain is better than a dead patient. So just let them know it's going to hurt, but this is going to help you. Focus on the location of the bleed. You don't want to, if it's a small cut here on the arm, you don't want to apply pressure to the whole arm. Just focus on the area that you're looking at. And like I said, make sure you cover it enough and don't put too much of the covering on it. So if you are using a shirt, just use enough to cover that and don't wrap the whole shirt on there because that might actually inhibit you to apply direct pressure to it, which is not going to be good for anybody. And most of the time, that should be sufficient enough to stop a bleed. If you apply pressure as you're supposed to, that's going to stop it. And if it stops, keep applying pressure. Don't let go. You guys are going to be there until first responders show up. It might be a few minutes. It might be longer, depending on where you are. So, you might be applying pressure for 5 minutes. You might be applying pressure for 20. In the event you guys start getting tired and there's other people around you, say, hey, can you come and help apply pressure? When you guys are changing, make sure there's still constant pressure so you can keep your arm there, have the other person push up on theirs, slide your arm, that way theirs falls directly on there and they can continue pressure. Always make sure, that that's sufficient enough pressure by looking to see if there's more blood coming out. So here, we are going to play a video where it shows you on how to apply pressure. So as you can see, she's identified where the wound is. She's going to use a t-shirt. She's covering or using just enough to cover the wound. She's not using all the whole t-shirt. And now she's using a two-hand technique to apply pressure. And that's just showing that that was enough to stop the bleed. If that doesn't work, we move on to packing. So say you showed up to the accident, there was an arm that there was a big laceration to, and pressure was not enough. The next step is packing. You're gonna try to use gauze, something that's clean, because you are putting it into their body. So this is gonna be for large wounds that, they're way too big for you to just be able to apply pressure to a small area. So as Michelle is showing, there's the heart drawn, meaning that's the top of the arm towards the heart. Blood goes away from the heart. So when you're packing, there is a specific direction you're gonna pack. Are you guys gonna pack towards the heart, straight in, or away from the heart? Perfect, yep. So you guys are gonna pack towards the heart. And when you do, you're gonna keep packing it in until you can't anymore, but don't force anything. You're gonna gently be packing it in, and once it fills up, don't, keep packing it in. Once it's done, use that and just apply pressure again. Pressure is the main thing that's gonna help, okay? So here we have another video. So here they're using Quick Clot, which is a specific gauze that you guys can purchase on your own. She's identified the wound and she started packing. As you can see, she's using quite a bit of it in there. Don't be afraid to keep putting it in until there's no more space to. And again, don't force it in. Once there's been enough that goes in there, she uses the extra to cover the wound, and then she applies pressure again with the two-hand technique. And again, packing you can do anywhere. It comes more into play where, like in the groin area, armpit, or the neck, where you can't apply a tourniquet. I know, in the moment you might think to apply a tourniquet to the neck. That's not a good thing. That's where you're gonna apply pressure. Especially here in the trunk, you're not gonna be able to apply a tourniquet, and nor do you want to, because then that, inhibits the patient from breathing or anything like that. So, usually anything that's not in the extremity, you're gonna be packing. And if it's anything in the chest or stomach area, there's not much that we can really do out in the field. We just have to get him to the hospital where the doctors can go in and do surgery if they have to. So now, say pressure didn't work and packing didn't work. So now we move on to the actual tourniquet itself. There's some rules to applying a tourniquet that you have, or that you want to follow, and you kind of have to follow. You always apply the tourniquet 2 inches to 3 above the injury. So so she's showing you over there where you would apply the tourniquet. You also don't want to apply it right on the elbow or on the knee, on the wrist, or on the ankle. So anything that bends or moves, you're not going to cover with the tourniquet. If you feel a bone sticking out, like here on your elbow, don't apply it there. Apply it above the elbow or below it. Again, 2 inches. If the injury is right here, make sure it's 2 inches where you apply the tourniquet above it, and make sure it's 2 inches below the joint where you're gonna apply. If it's really close to the elbow, just apply the tourniquet 2 inches above the elbow, even if it's more than 2 inches from the initial injury. And then once we do hands-on, we can show you more clearly. Make sure you tighten the tourniquet until the bleeding stops. Once it stops, you stop. Don't keep tightening it, because that just won't do the patient any help. And once you put a tourniquet on, it stays on. There used to be this rule back in the day that you would do certain things. You don't anymore. It stays on the whole time. Once you put it on, it stays on. a tourniquet can be applied to someone else, and it can be applied to yourself. So you guys are going to learn how to apply it to yourself as well, because you guys might be in a situation where it's just you. You have a wound or an injury that's bleeding profusely. You guys are going to want to know how to be able to apply it to yourself. So you guys are going to get to learn how to use the equipment on yourself as well as on others. It can be applied over clothing. So, some shorts, sweatpants, those kind of things, yes, it can. But if it's a heavy jacket or really thick pants, you guys are going to want to remove those, because that's not going to do any good to use a tourniquet over heavy clothing. It's going to hurt, like I said. If you apply pressure, if you pack, and a tourniquet is the most painful one. Tell that to your patient. Hey, it's going to hurt, but it is going to save your life. Like I said, a screaming patient is better than a dead patient. Sometimes a second tourniquet might be needed. I know a lot of people don't, just carry 2-3 tourniquets with them at all times. So usually police will carry tourniquets. They'll be able to give more. And if you can't get a second tourniquet, stick with what you have and work with that. So here we have another video of them actually applying a tourniquet. So here we're assuming that they already identified the bleed. As you can see, she's looping it around the arm, and she's going to put it through the little loop that's in there. When she does this, you can see that she tightens it. So initially, pull hard on that. Give it, make it tight from the start. Next, there's a little metal pin that you twist to apply even more pressure, and that's what will initially or ultimately stop the bleed. Once it's stopped, you're going to clip it in to the little thing that's built in. You're going to finish wrapping it around. And next, you're going to cover it with the timestamp. It's important that you write down the time you applied the tourniquet. This is going to help doctors once the patient gets to them, because then that determines how long the tourniquet's been on. Make sure you write the time. I always keep a marker with my tourniquet in there as well, along with my gloves. As you can see, the strap, it's white. So if you think of it, the patient's going to be bleeding. It's going to get covered with blood. So if that gets covered with blood, just write it above their arm. Write the time. And then another place you're going to write it is on their forehead. So you're going to take the time, write it on their forehead. Why? Because when you get to the when they get to the hospital, they might be covered in blankets. That's what, on the ambulance, you'll get covered in a blanket. So it's going to be hidden. Last thing you want is a doctor to, not know that there's a tourniquet on there and forget about it. But if you write it on the patient's forehead, that's the first spot a doctor's going to look at. They're going to look at the patient to see if they're awake or they're unconscious. And if they see writing on their forehead, most doctors are going to know what that is. They're going to say, there's a tourniquet somewhere on this patient, or there's something on this patient that was timestamped. Let me find it. That way everybody knows. Also let first responders know, hey, I applied a tourniquet at this time. I applied 2 tourniquets. Every tourniquet you apply, write its own time for. Here are some that the committee has said this is what we recommend using. The big name for them, they're just the tactical tourniquets. They all look different, but they work the same as the ones you saw in the video where they strapped it, used the metal pin to tighten it. If you guys have your own or buy your own, make sure you know how to use it. Practice on yourself. Last thing you want is to show up on an accident and not know what to do. So make sure you get to know your equipment first. And then here, it's just the names written out. This PowerPoint will be provided to you guys in case you guys want to go through and search them up, the actual names. These are a bit different type of tourniquets. These ones you don't really see much out in the field. If you guys have ever gone to the doctor's office, you know when they check your blood pressure, how they pump it up. That's the same way these ones work, where you pump it up and use pressure or use air to apply the pressure that way. So accidents, you know, you don't really ever want to think of it happening to a child, but it does happen. Back in the States, when I was an EMT, I've applied tourniquets to children. I've applied them to adults. This can happen, you know, from a 5-day-old up to a 9-year-old. No one, you know, you have to be ready for whatever comes your way. Essentially, it's all the same. The only exception with tiny, tiny little babies. A tourniquet can only work up to a certain size. As you guys will be able to see, you can't tighten it, you know, past a certain diameter. So if it's a tiny little kid, you guys are not going to be able to apply the tourniquet. But you guys have your hands. Again, it goes back to pressure. Pressure is going to be enough to stop the bleed on little kids, on just simply your own strength. Use both hands if you have to. And again, packing, applying the pressure, applying the tourniquet, same technique that you would do to an adult, you do it to a child. So some of the frequently asked questions is, what if on this accident there's this, you know, like a piece of tree sticking out because they fell on the tree. In a car accident, a piece of metal went through it. Leave it in there. Never pull anything out. Treat it as the injury itself, or the major source of the bleed. So again, use the 2-inch rule, 2 inches to 3 inches above the injury. You know, don't put it over the elbow, the ankle, anything that moves, don't cover that up. Improvise tourniquets. Say, you know, you're out on the beach, you forgot to take your tourniquet and something happens, say a shark bite. The committee hasn't, there hasn't been any scientific data to show the effectiveness of an impromptu tourniquet. That's, you know, making it out of a t-shirt, a belt, anything like that. So they don't discourage you from using it, but again, sometimes it might actually cause more injury than actual be actual helpful to the patient. So use your best judgment. I've showed up to an accident where someone had used their belt on our patient's arm to stop the bleed, and it worked. So it can't, you know, I'm not saying it's not going to be done. You know, use your best judgment. Ensure that if you are using it, try to use it as best as you can. So if you're using a shirt, you know, fold it up, roll it up, tighten it, and you can use a stick or something sturdy enough to improvise and use as the little metal pin that comes on the tourniquet, and twist that to make it even more tight. Because you can only make it so tight by just putting a knot on it. You're gonna need to, you know, keep making it as tight as you can and using something sturdy to kind of twist. And we'll show you guys how to do that hands-on. Some people are afraid to apply a tourniquet because, you know, you'll hear stories that if you apply a tourniquet, they're going to amputate the leg. The best way to go around this is saying losing a leg is better than losing your life. So yes, they're going to be scared, but ensure them, hey, let's, you know, save your life first, and then we'll see, you know, the doctors will see what they can do. But, you know, don't just let them die in fear that, you know, they're going to lose their leg. Because if they're dead, what good does that do for them? Nothing. Pain. It's going to be painful. When you guys practice on yourselves, you know, you're not going to tighten it all the way, but you guys are going to start feeling the pressure and the pain that comes associated with that. So then you guys can think how much it's actually going to hurt when you do it for real to someone that's injured. But at that moment, you know, it's better that they're in pain than having a dead person. Do you guys have any other questions at this moment for me? Okay. So just a quick summary. The first thing, again, your safety. Don't become the second patient. Make sure, as in the previous presentation, use all your senses to determine if it's safe. Smell for gas. Look for any possible things that might fall on you, might hit you, any kind of thing like that. Feel for heat. Is the car going to burst into flames? All that kind of stuff. Use your senses to determine if it's safe for you. If it's not, remove yourself from there. Emergency personnel will be able to deal with that once they get there. The next one is alert. Call 912. Get services on their way. That's going to be the first thing. Next, find where the bleeding's at. Remember, like I told you, it might not just be in one spot. Make sure you ask and check all over where you can. If there was a shooting, don't just look for where the bullet came in. Look where it might have come out. So if it came through the chest right here, check the back. It could have gone out. It could have stayed in. You always want to ensure, because no good's going to do it if you're only plugging one side of the injury when there's another one behind it. So make sure you figure out where and how many spots are bleeding. Next, pressure. Pressure is the main thing. You guys are going to apply pressure at any point. If that doesn't work, you're going to move on to packing. If that doesn't work, then that's when you move on to the tourniquet. And you guys are going to stay there and wait until help arrives. You don't want to just apply the tourniquet and go on your way. This patient needs you. Stay with them until someone else comes and takes over. For any more questions, information, you guys can go to stopthebleed.org. They have a specific site within there where they sell first aid supplies. They sell tourniquets. They sell anything you might need for an emergency. They sell it right there. They have little kits that everything's included. That way you can just throw it in your car, keep it there, keep one at the house, all of that. And again, last thing you want is to not know what to do in an emergency. This is why we're teaching you guys this. We want you guys to be able to feel confident when you walk up, see an injury, know exactly what to do, and know how to save that person. With that, we're going to move on to hands-on. So thank you for your time. We do have a quick little demonstration that we're going to show you guys before we actually get to practicing on one another.
Hello, my name is Noah and I am 11 years old, and today I will be using a stop the bleed technique on my mom.
Like that. Thanks, you guys.
All right, good job. That concludes our presentation. And now we're going to practice with all of the wonderful people here today.
Center for Disaster Medicine. One of the things we talked about was if you don't have a tourniquet available already, if you need a second one, using a second. Oh, sorry. using a tourniquet or using a second tourniquet. So I always ask the question when I'm in the room, what in this room could I use as a second tourniquet? I'm sitting on the beach, I gotta look around and I'm thinking to myself, okay, I've got a shark bite, somebody's been, still has an arm or doesn't have an arm, and I want to put a tourniquet on, but I don't have one, or it's out, it's back in my house, or I didn't put it in my car. What could I use? So I look around the room and I say, think what's in this room that I could use. Anybody have any ideas?
All the people around.
Anything you've got around. So shirt.
Belts,
Break it down.
scarf, hair. Hair?
That's I gotta find somebody with a scrunchie. Doesn't anybody has a scrunchie? So she's not gonna take it off for me. You can take off her scrunchie, right? You can put the scrunchie on her arm, and then find something, anything that you can turn and twist to make it tighter on the arm, and then hold it there. The important thing is, if you have a patient you put a tourniquet on, and you're using a improvised tourniquet, this is the problem we had at the Boston Marathon. But I don't know if you guys remember. Most of you will probably remember back to the Boston Marathon. People put on improvised tourniquets, but the problem was by the time you got to the hospital, they lost so much blood that their arm got thinner, so the tourniquets weren't working. Now, luckily, nobody died from that, but they could have. So if you put an improvised tourniquet on, do not leave your patient. You may have to turn it tighter, turn it tighter, turn it tighter. So, it makes it tougher if you have 2 or 3 victims, because now you're like, I can't leave. So what you do is I would say, you stay with her, and if she starts to bleed, you tell me, now I'm gonna move on to my next patient. So it's all about thinking, what's the worst that can happen? How do I not let that happen? So if you grab, everybody's got these gloves on, and we got fish. All right. Yeah.
How do you know how tight to put it when the blood stops?
When you don't see any more bleeding, and if they don't have any bleeding, let's say that they lost an arm, you're putting it on, but the bleeding already stopped because, they were unconscious, you put it pretty tight, because if they wake up and their blood pressure starts to go up a little bit, now they're gonna be losing more blood. And I would think of blood like money in the bank. You want a good amount of money in the bank, and as they keep bleeding out, the balance is lower and lower. And as you get really low, you start to go, I don't feel so good. And I don't know if I can pay my bills, so I want to make sure I can pay the bills. So keep as much in the body as you can, the bank as you can. So we've got these, you can try to pack if you want to make sure that you, getting your finger in the packing. And then we have the tourniquets, and we'll go around and help you with the tourniquets. All right, please. Make sure everybody can go. And remember how to Velcro to Velcro. So you see it's already tight, right? But now, Velcro. Then you're going to take the wind just like you're sailing, and you're going to turn that. It doesn't matter which way you turn it. If you get tighter and tighter, and tighter, then you're going to make sure it snaps in place. You want to make sure it snaps. Yeah, there you go. And then finally, you're going to hold it not time yet. Put this back over this so it doesn't move. Think about it, you want to see that time that, you know, and then that goes right off. Some of the churches, they have a 10 of they have a 10 in there. So if you want to be military way, they double up, they triple up. Oh, absolutely. Duct tape around trauma. Duct tape fixes all. Good for everything. You still have to put it on yourself. So you have to put it on yourself. I was actually walking around all morning with my. Tight. Once it's locked in place, lock it in place, black over, lock it down, and then you start bring it on their way.
Sometimes you have to hold it for a long time until it comes out.
So let's say this week is right here. Where are we gonna put the tank? Where you want me to, and I want to stop here, where we gonna put it?
Fingers that fall asleep. Fingers that fall asleep.
2 inches above, 2 inches above. I took it off before, right? We don't put it on that. We don't put it on anything. Kurt's right.
No, not bad.
There's a lot of things that's. Yes, I got
Elbow or above the wrist or. The problem is that if you found belts around them, the belts aren't doing anything because they're remember, their arm right now is this.
That's what we're here.
We use the belt where you kind of, try to push the belt to be tight. As it got smaller, it got loose.
If they can say out, that means that they're still alive.
Don't put anything. Yeah, no. Better if you don't put anything. The salt's not going to it's not a problem. If you're trying to get to the hospital, then yeah, you get product is good, because around here, I mean, swimming, you have yourself, and it's not serious water, it's not, it's like, not that either. So, So anyway, I highly recommend, honestly, your tourniquet in your car. And the reason for that is if you are alone and somebody needs it, you can run out to your car. But if you leave it at your house and you're out in your car, you can't run home to your house and go get it and then come back. So, you always have your car with you.
I keep it in my backpack every day.
Army movies, yeah, love action, and
Anytime
soldiers.
I go scuba diving, I have it. Anytime you go to these like, it's better than looking. Did everyone find a cat? Yeah, show me some.
I have one of those in the house. So it's pretty easy to use. And you have questions. I always tell people, when you're already know when you talk, you can do it all. What are their things? What are the basic things? You don't say knock them out. That's not the right thing. Unless you're an MMA fighter.
Why we have. What would happen if we have?
Here, I think she's gonna get off her, she's now a doctor.
Right?
Doctor here.
And it's really hard to tell.
It's a young. You know what? You're afraid to put a pair of gloves in there?
Yes, and I'm like that. So maybe when you have a day, I don't know, I don't use it already, but you do it.
And one other person around, how are you gonna find such goals?
Three injuries.
So let's say, for the sake of an argument. Not like that, it'll work. So let's say for the sake of an argument, somebody is stabbed, and I hope that it doesn't happen, but I know it does. And you've got somebody who's stabbed and they've got the knife sticking out of them. What you don't want are a branch. They were, going on a mountain, they went up the mountain, child went up the mountain, they found a tree, they went up there to take a picture, they came down the tree and ended up getting a branch sticking out. What you don't want is, you don't want that, you don't want to pull it out. Remember we said if you have an impalement, if something's going through, you can leave it in, and then you just kind of tack around it. But if you can, try to take a cloth, a t-shirt, and wrap around the impalement, or if you can remember, and I can show you how to do this, but you take something like this, create a donut. So what you do is you kind of make a circle, you keep putting it through. That's something I do a lot of times. People will see when they're giving lectures. I'm sitting here just wrapping, and I don't even look anymore. I just kind of wrap. And what I do is I've made a donut hole, a circle. And I don't have my knives with me.
I grabbed scissors. Because scissors are getting a lot of use to doing.
There we go.
I'm glad you come.
So if I've got, a knife sticking out of me, I can put this around it and then tack this, and this isn't going to move. Because think about it. If somebody stabbed me here, and it's an inch away from my heart, and this thing's moving down and moving up because you're trying to get me out of the, down the hill or, somewhere, when you're trying to get me to an ambulance. If all of a sudden this thing starts to move and does this, That's it, that's it. That's it. It might not stab me in the heart, but I just moved it and I got myself on the heart. So you put this around it, and then you take this down. This will stop this from moving up or down, left to right. Keep it right where it's at, and that's what you want to do until you can get them into the hospital and we can get them open and find out, you know, how do we take it out without causing it to bleed.
Put the donut over the knife.
Yeah, put it right over the knife, just like this. So if this knife was sticking out of me,
Yeah.
put my donut, you put it right over it, and then tape this down, and then you can lift me up and walk me out and go, you coming, get to that sidewalk, the ambulance is coming. As opposed to, you know, if it's moved, if it's free, and all of a sudden it does, now it's going right up and catching major vessel or puncturing my lung or something that it didn't do before, but now I get a problem, so. That's part of the wilderness medicine course that we could be teaching here. But there's different things you can do. It doesn't stop with just having tourniquets. There's all sorts of things that you can learn how to save, you know, keep saving lives. And so, but packing, the compression, packing, the tourniquet, you get three basic things you want to make sure that you have when you're thinking about.
Or with a gunshot. If I see somebody with a gunshot, and I know the bullet is there, but can I find it?
Pack that hole, and what you gotta do is look on the backside. Because if it came out the backside, the bigger injury might be in the back. Or if they got shot in the back, you might be looking at a big injury in the front. If they've got a small injury in the back, it's still bleeding. Both, yeah, you gotta do both. Otherwise, you got control of the front, they bleed out the back, or you got control of the back and they bleed out the front. So you gotta kind of roll them over and take a look and see what's going on. Same with the knife wound, actually, depending upon where the knife wound is. Because if I stab you and I go here, I might get in here. He's also got one eye here. All right. So everybody who came today, we're going to be presenting you with one of these. Well, I'm not quite sure how we're going to get them. I'm going to talk to you guys about that. But which is a certification saying that you took the course, that you understand how to use a tourniquet, compression, packing, and you'll be registered with the American College of Surgeons, so that if anybody ever asks, you can say yes. And you know, I have first aid, if you take first aid, stop the bleed, etc. Certification, and presently, actually, I can't say the number of people who have been trained because around the world, because with COVID, it stopped for a while and restarted, but it is in the millions of people who have been trained on Stop the Bleed, and congratulations to all of you for joining that nice fraternity sorority.
Hope you all enjoyed our live viewing and learned some valuable first aid techniques. Thank you for watching and see you on the next video. Bye.